Lowering cholesterol. Effective tips. Learn how to lower your cholesterol in this video. The human body produces cholesterol, a waxy molecule that is also present in foods derived from animals. Despite the fact that cells do require some cholesterol to operate, too much cholesterol tends to accumulate in the arteries. When a person is young and their body is still developing, their cholesterol level starts to rise. Until that point, our bodies use the cholesterol we ingest from meals to help us grow. When our height stops growing beyond the age of 18 to 22, the body's level of cholesterol also begins to rise. Up until the age of 40, practically everyone who consumed junk food, meat, alcohol, and tobacco on a daily basis and did not engage in any physical activity experienced symptoms of high cholesterol. If we pay attention to it at first, we can control whether cholesterol levels rise or fall. Before we continue, help us make this video the record holder for likes on our channel. Your likes not only show support, but also help YouTube recognize the video's relevance, leading to a wider distribution and increased awareness. If you haven't subscribed to our channel yet, we invite you to do so and activate the notification bell to stay updated with our latest content. Additionally, please share this valuable knowledge video with your friends and family, spreading awareness and empowering others with important information. Together, we can make a difference and create a positive impact. You can also tweak things out. Cholesterol comes in a variety of forms. Your chances of developing heart disease, having a heart attack, and having a stroke can increase if you have high levels of LDL or bad cholesterol. A lower risk of heart disease, heart attack, and stroke has been associated with HDL, the good cholesterol. The two primary types of lipoproteins, low-density lipoprotein or LDL and high-density lipoprotein HDL, are responsible for carrying cholesterol through your system. LDL transports fat from the liver to the cells, acting as a fat delivery truck that gathers up cholesterol. The cells can take up additional cholesterol when it is available for distribution. The additional cholesterol that has built up on the arterial walls is removed by LDL cholesterol. Your risk of heart disease and stroke rises when your blood contains a lot of LDL cholesterol. The way HDL transports extra cholesterol to the liver is similar to a garbage truck picking up trash. Having high levels of HDL cholesterol lowers your risk of heart disease and stroke. Now, how is blood cholesterol measured? To determine your cholesterol, a blood test is required. A cholesterol test, often known as lipid panel, assesses all blood lipids including total LDL and HDL cholesterol. Since high cholesterol levels don't make you feel ill, the only way to determine your cholesterol levels is through a blood test. Plaque can accumulate in arterial walls as a result of excessive cholesterol. Atherosclerosis, the name for this buildup, can cause peripheral arterial disease, heart attack, stroke, or transient ischemic attack (TIA), as well as coronary artery disease (CAD). These issues are brought on by atherosclerosis because when enough plaque accumulates, it narrows your arteries. This occurs gradually over a long period of time. Eventually, the plaque may restrict blood flow to many parts of your body, including the heart and brain. A healthy artery can broaden and dilate to allow more blood to flow through when necessary, such as during exertion without hardening your arteries. An artery may become too stiff to widen if cardiac plaque builds up in its walls. The blood flow to your body may be hampered by artery hardening. Block your arteries. Blood clots can block an artery when they develop around a plaque break or rupture. Heart attacks and strokes can result from this. Now, what are some ways to lower cholesterol? Because a high-fat diet raises cholesterol, consume less overall fat. Using less cooking oil, that is lipids at room temperatures, such as canola, corn, soybean, and sunflower, will help you lessen your total fat intake. Reducing cholesterol alone is insufficient. You also need to reduce total fat. Get more exercise. Your protective HDL cholesterol level rises as you exercise. Take an additional weight off. Even a 5 to 10 pound weight loss can raise HDL levels and lower overall cholesterol. Consume more soluble fiber to reduce your cholesterol overall. Reduce your risk of heart disease and raise your HDL levels by giving up smoking. The two therapy options are as follows. Number 1. Change in way of life. Number 2. Statins as prescription drugs. The National Cholesterol Education Program classifies different amounts of total cholesterol into the following categories. Under 200 milligrams, DL is desirable. Between 200 and 239 milligrams DL is borderline high risk, and 240 milligrams DL or over is high risk. It may be helpful to measure the different forms of cholesterol if your total cholesterol is high, especially before thinking about taking medication to lower cholesterol. Because of the risks and probable side effects of drugs, a low-fat diet is usually sufficient for lowering cholesterol in most people. Only those at a higher risk for heart disease should consider taking cholesterol-lowering medications. If you are between the ages of 40 and 65 and have a very high risk of developing heart disease, adding a cholesterol-lowering prescription may be useful if you discover that a low-fat diet is insufficient to reduce your cholesterol. The most crucial step in lowering cholesterol and reducing the risk of heart disease is reducing LDL and triglyceride levels. Low-density polyethylene raises HDL levels while lowering LDL levels. High-density polyethylene is equivalent to healthy cholesterol. First and foremost, we must cut out foods from our diet that are too high in carbs, saturated fats, and bad cholesterol in order to reduce the level of LDL. To do this, you must temporarily cut back on or totally eliminate foods like meat, eggs, fried foods, dairy products, butter, wheat, sugary sweets, cigarettes, alcohol, and packaged snacks from your diet. In addition, try to incorporate as many fiber-rich foods in your diet as you can. Examples of such foods include multigrain flour, porridge, brown rice, barley, and millet, green vegetables, carrots, beets, spinach, turnips, okra, cauliflower, mango, watermelon, pomegranates, and other seasonal fruits and vegetables can all be used. For breakfast, people with high cholesterol levels should eat vegetables, fruits, salad, sprouts, soup, and juices. After this, for lunch and supper, 40 to 50% of the food should be fruits, vegetables, and grains, and the remaining 50% should be typical everyday cooked food. The morning meal should be fully oil-free. The importance of this type of diet is especially significant for individuals who don't exercise and spend a lot of time sitting down at work. If you stick to this diet plan for just 5 to 6 days, then on the 7th day you will see a remarkable improvement in your body's energy levels because as you alter your diet, your body's level of good cholesterol naturally starts to rise. Blood purification starts, and the results are felt both physically and cosmetically. Additionally, garlic is excellent for lowering cholesterol. According to 2013 research, using half to 1 gram of garlic daily will quickly lower the body's elevated levels of cholesterol and triglycerides. Both raw and roasted garlic can be utilized, and along with these treatments and some dietary adjustments, precautions are also crucial for lowering cholesterol. Avoid dehydrating your body by drinking at least 7 to 8 glasses of water each day. Take a daily morning stroll to strengthen your nerves, lower your bad cholesterol, and keep your arteries flowing. Avoid using fried ingredients in your cooking, and if you consume meat, stop for a while. No matter how many over-the-counter medications and home treatments you try, nothing will help you if you are hooked on smoking. Even if you take medications to lessen your risk, changing your way of life is still crucial. I hope you find your way to change your routine and lower your cholesterol. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching!